Welcome to Dr. Gor Show. So it's really my privilege and honor to have Dr. Ken Hansraj in the studio. Welcome to Dr. Gor Show.
Thank you.
So Dr. Hansraj started his career in Philadelphia. Then he came to do his training in orthopedics at Mount Sinai. Then he did his fellowship at Hospital for Special Surgery. And then he learned minimally invasive surgery from clinic in California. So he has had a wide range of experience and training. Not only that, he's had multiple publications in very, very prestigious journals. He's been interviewed multiple times on television. And he is author of a bestseller book called Secrets of the Cervical Spine. And we have lots to cover with him. So welcome to Dr. Gor Show.
Thank you very much, Dr. Gor.
So looking at your credential and looking at the amount of work you do, like you should be 100 years old. And it's been just amazing to read about your journey and what you have done so far. So your main focus, because orthopedics takes care of a lot of different things, but your main interest always has been spine?
Only spine, yes. 100% spine.
So what kind of, spine issue that most people come to? Like growing up, we all have some back pain, some neck pain, lumbar pain. Always our parents talked about posture and sit right, otherwise you're going to have back pain. What kind of drove you to get interested in spine and back pain?
So I was very fortunate to work with the great Indian master, Dr. Chitranjan Ranawat.
Of course. He's the one who did our ex-president's surgery.
Yes. And he was the world's best mentor. Mm-hmm. And I love him and I'm grateful to him. And he is the greatest hip, knee, and joint person.
So talk about back pain, right? It's a major issue for most people in most countries. A lot of money in healthcare goes in back pains and stuff like that. That's usually like a chronic condition most people will complain of. So talk about back pain in South Asians. Living in US, living in India, is there a difference?
The studies show, Dr. Gor, that 4 out of 5 people do have or will have a significant spinal problem at some point in their life. And so even in populations that are more rural, human beings suffer equally across the planet. 4 out of 5.
I think we are paying the price for being upright, I suppose.
Yes, exactly.
So in terms of, because everything comes back to healthcare money, right?
Yes.
What is the amount of cost the back pain or neck pain has on, the budget?
So we have an effort where we've calculated the costs for each country, mm-hmm. right? And this is available on my website.
Okay.
So any country can dial in and find their cost. Now, the cost for United States, we extrapolated from the 2006 numbers mm-hmm. to today. Today's cost is $115 billion.
Wow.
And so our GDP is $17 trillion. So it means that we spend about 1 in 150 GDP dollars on spine care. So we did estimates. When we estimate for different countries, we'll say, hey, if you paid as much as Americans do on your GDP, this is your cost. But we believe that most countries are spending at least half that, between half and full range. So we estimated half and the full cost.
So that's a huge number of cases and burden in general. Tell me, when somebody comes to you and, what is the first thing when they are referred to you? They've tried, say, massages, they've tried the chiropractor, they've done the most routine stuff of MRI, injections, and evaluation of the disc. I think that's when you come in, correct?
Yes.
So when you are talking to these patients, what is the first few things that you'll tell them about the posture, about what they're suffering, if there's any way to kind of remedy that without going through surgery?
So there are many ways, and that's the key, really. That's the source of my book, Keys to an Amazing Life. And so when I sit down with a client, right, I feel responsible to tell them 5 things. One, to be very careful with your posture, because efficiency in posture is tremendous. For example, with posture, Amy Cuddy in her study from Harvard showed that you have 20% more testosterone in 2 minutes, more serotonin, more dopamine, and less cortisol just by being in good posture.
Wow.
And I encourage them to do deep belly breathing. I show them spinal range of motion activities. And I show them how to strengthen their spine. And my last strategy would really shock you from a surgeon. I highly recommend that people meditate, because the studies are saying that when you meditate, the frontal cortex becomes thicker. The reactive emotional brain, the amygdala, becomes smaller. And your whole brain becomes positively bigger and better. And the brain and the spinal cord are the same thing.
Correct. So there's a big connection between your posture, your thinking, your relaxation, your meditation, and just how well we kind of take deep breath. So most of the teaching is of yoga, correct?
Exactly.
About the posture, about the breathing and meditation. It combines
fundamentals of yoga.
Yeah. So you highly recommend that. And I saw it on your website that you recommend Pilates as well as yoga as a way of proper breathing. So you've done this talk, and something which was very striking is about what our kids do nowadays everywhere, and what we as adults, we are stuck with our cell phones, be it texting, email, social media, Instagram, whatever our postures have changed, and the amount of pressure it affects on your neck and spine, that was really shocking to me. So do you want to tell our viewers about texting and your positioning, how it affects your spine?
So we did a study. So there is the practice of spine surgery where we've done thousands of cases of spine surgery. And then there is the art of spine surgery where we try to help people, and people everywhere. So we took the oath to help 100 million people, and we quickly surpassed that. Right? So we did a study with the highest level mathematics, and we placed a human spine and skull in the computer. We modeled it. And when the head is straight up, it weighs 10 to 12 pounds. And when the kid or the adult brings their head down 15 degrees, it's 25 pounds of force. And at 30 degrees, it is 40 pounds of force. And all the way to 60 degrees, it is about 60 pounds of force, or 5 to 6 bowling balls of force on your neck.
That is really a very important point, because neither do we realize amount of pressure and the change and its effect over a long period of time just by looking down.
So my message is not to give up cell phones or reading. So I interviewed the great guru, Sri Sri Ravi Shankar. Tremendous privilege. And he taught me, and I've used it globally.
Okay.
So it's from him that I learned. We were talking about posture. And he said to me, right, posture, he says, is the basis of every asana. Is the basis of everything good.
Correct.
Right? But he says, people miss it. Even your eyeballs have a posture.
Wow.
Right? So he says, be careful where your eye is in space. And so my recommendations, which have traveled globally to every country, to billions and billions of people, my recommendations, I use Sri Sri's recommendation. So I say, lift your book up a bit, but remember your eyeballs have range of motion, and look down a bit. So it's a marriage of looking down and lifting up.
Your neck can be upright, but your eyeball can move.
Yes.
So keep your posture correct. Your eyeball can move, and
Yes.
do that way. So that's, I think, a great message, that certain points we can't change the location of your stuff, but keep your neck straight and learn to move your eyeball. You know, you've done your investigations, you've taught people meditation, yoga, the right posture, the eyeball movement, but certain point you might have to start intervening. And you have improvised yourself by going out and learning minimally invasive surgeries in the past, and you've done multiple cases and thousands. So what has been your experience?
Most every surgeon today, aspire to have the smallest incision, the driest incision, approaching bloodless surgeries. And so, and it's really an art. So if you have a person with a very thin back, so an incision for a discectomy may be this big. And that you can call it minimally invasive or microendoscopic or call it 100 names. It'll be a small incision, you can see it. But if you have a patient with a humongous back, more and more, we're facing patients that have bigger bodies. And let's say you're dealing with a 400-pound patient and you're doing a simple L5-S1 disc, for example. Your incision, which in my heart is a minimal incision, might be this big because you might be reaching down a whole foot to operate. Right? So minimally invasive, we all aspire to do the least incision, the least and the most effective in surgery. And more now, we have so many strategies. We have intraoperative O-arms, so we put a few needles and we know exactly where we are. In the past, we used to get an X-ray and we'd wait 10 minutes for the guy to come back. Now we have an immediate feedback. We know where we are, so we make a precise incision. And now we have the O-arm, which is an intraoperative CAT scan, which is absolutely amazing, just astounding for precision and predictability, and especially for instrumentation and placing pedicle screws. I mean, your precision is about 1 to 2 millimeters.
There has been a lot of different other tools as far as minimally invasive or bloodless, especially robotics. When the robotics came in gynecological field, the whole game changed because the pelvis being such a narrow area where we had to really struggle and our postures used to be the most horrendous. I remember coming home most days after the OR and something or the other used to ache. And robotics kind of changed the way we do surgery. Not only was precise small incision, but blood loss was very less because we could see small blood vessels. It was magnified. So talk to me because, robotics in spine was like, that's interesting. Where does that play in?
It's astounding what's happening. So we have the O-arm, which is intraoperative CAT scan, and we can place instrumentation very precisely. But even beyond that, now we have robotics. And the robotics were, I just sat with the company Mazor in Florida. And so the people that developed the CAT scan were in charge of developing the robotics. And so they've developed algorithms for identifying each vertebral body. So if you're the L4 and I'm the L5, right, the computer knows our topography and geometry. So if I move or if I sit over there, the computer says, nope, you're Hetal, you're Ken, like that. So it knows the L4 and L5, really knows them and can assess them as things move. And so with the algorithms and the pre-thought and the pre-planning, placing, for example, instrumentation happens in 5 to 7 minutes as opposed to 90 minutes or 60 minutes.
Wow. So your OR time has reduced drastically.
Yeah, and blood loss.
And the positioning is the same as traditional?
Yep.
So the advantage is definitely to the patient as well as surgeon. The less time on table, the less time on anesthesia, the less kind of complication and blood loss. You've done some work and you are a big proponent of stem cell in use for spine surgery. So tell us, what has been your experience with using stem cell? Is it autologous or there is a donor? How are you working with that?
So stem cells, I wanted to learn it, so I wrote a paper about it. So for a few years, I meditated on what are stem cells. And so when you say stem cells, it really means you don't know what you're saying. They're really different types of cells.
Correct.
So for example, there's the EPC, the endothelial progenital cells, which brings in blood vessels to the area. There's the MSC, which heals cartilage or builds new cartilage or bone. And there's the hematopoietic stem cell, which is a precursor to the MSC. use your own autologous stem cell. This is not controversial like using a fetus or something like that. So we put a needle in the pelvis, and we would draw the bone marrow, and we spin it down, and so maybe 60 cc's will give you 2 to 3 cc's of stem cells, which is very precious.
Right.
Now, my work with stem cells, right, it's proven by studies to help fusions happen, and it's now proven by studies to help degenerative disc disease. I've used stem cells in a set of patients that are really suffering, failed spinal surgery, decades of pain. So LifeSet just did a story on one of my patients. I didn't know it, but she was taking 90 to 100 milligrams of narcotics and drinking a bottle of vodka every day. Her life was out of control.
Okay.
And so we explanted her instrumentation. We cleaned up a nerve that was a bit tight, and we augmented the fusion. We augmented the surgery with stem cells. Today, she's lost 130 pounds. She's doing fine. She's doing great.
And hopefully off those medications. So,
she's off the medications, yes.
So as Dr. Ken just mentioned, stem cells are the cells that are in kind of immature. They are ready to kind of develop and grow into things. We used to collect cord blood, and now we collect some part of the tissue and the cord because the cartilage point of those cells come from that. And since they regenerate, they kind of heal the area where it's hard to put instrumentation, if I can put it in straight way. Now, that kind of helps some people who you have very osteoporotic kind of vertebrae, where if you put a screw or a needle, it's going to just go through. So this is kind of a good kind of cement that you can put in.
It's another option, another good option.
It's a great option to talk about. So we're going to take a short break, and we'll be right back. Welcome back. So today's topic is, back pain and neck pain, and why and how and what can we do to prevent it. To talk about this important topic, we have Dr. Ken Hansraj with us. So far we've discussed about the posture and positions and what can we do and how big and huge of a problem this is. Now, going back to, the stem cells and robotics and minimally invasive surgery, there's lots that can be done. And the science is improving every day, and we are applying the different aspects of physics and technology to medicine. But small things make a difference, and it was especially coming to women's health. More and more women as such do suffer from back pain, and most of the time they blame it on either, the epidural they got during labor or their posture and stuff, but sometimes it's just not that. Sometimes it's their weight and especially their breast size, right? You did an observation on changing the cup size and how it affects your spine. It was very enlightening. Can you tell our viewers what that means?
So when we did the TexNeck study, the whole world restudied it. And so we were tested over and over. And first we were scared, and then we realized we had great models. So then we implemented the breast. So we have every single commercially available breast size. So the 36A is a 15 pounds of force.
Okay.
36D is about 28 pounds of force.
Wow.
36D is 32 pounds, and all the way to 36N, which is 110 pounds of force on the spine.
Wow.
But here's what my patients tell me. Doctor, just because I have small breasts does not mean I don't have back pain. Even the 36A, which is 15 pounds of force, is almost a bowling ball of stress on each breast. Right. It's an astounding amount of force that the spine sees.
So a lot of times when we have patients who have a very large breast, and for insurance companies to kind of approve their reduction is depending upon how much back pain. But to have that actual size and amount of force definitely will help so many women to kind of get that procedure approved and show people that definitely there's a correlation. So lastly, to talk about the secret of cervical spine. And it's just amazing you've done studies, you do all the research and surgeries and your family life, and then you wrote a book. So tell me what kind of drove you to write this book, and in a nutshell, what does this talk about?
This team of artists, I dare say that our images are some of the best in the world. Because, for example, when Frank Netter drew, he did not have access to 2.5D shadowing, that almost 3D feel. So my team and support and clarity and editors, it's just a great product, I think.
What does somebody who wants to buy a book, what are they going to learn from this about how to avoid it? What can they do?
This book is for everyday people. It's written for everybody. And so one of my friends told me he has a second grade reading and he can read it.
Okay.
And so it tells you about the spine, you learn about the spine, you learn about the nerves, and you learn about everyday things that impact your spine, from the way you sleep to your posture, to the kind of work you do, the different jobs, the nurses, the dentists, and how to do yoga, and different strategies that are very little known, like cranial sacral osteopathy, all the way to how is surgery done and what is actually done and what is your rehab protocol.
So this is like a Wikipedia of cervical spine and what to do and what to expect if there are problems. So I think it will be a great read for kids because, you know, if they start the right habit at the right age, I think we can prevent some of the issues coming up. So I think this was a wealth of knowledge for our patients and our viewers. So thank you, Dr. Hansraj, for coming, taking time out of your busy schedule and to be here. And we hope to see you again, and we'll talk about some new technologies and some new developments.
It's my pleasure, Dr. Gor. It's really nice to be with you.
All right. So viewers, if you have missed the show, it will be uploaded on YouTube. And as you've seen, Dr. Hansraj's telephone number as well as website, you can contact him. You can go on his website. There is a lot of information available. And his book has a lot of information and knowledge. So it starts from young age, right posture, right neck. And every time I'm going to slouch, I'm going to think about you and be straight and keep the neck straight and maybe let the eyeball roll down. Thank you so much.
Thank you so much.
Till next time, you're watching Dr. Gor Show. Thank you.